Now, for those of you that have pain at the front of the hip, there is an absolute vital thing that you must consider that you can't look over, that we're going to go through in this video to make sure that you're not putting yourself at risk. Now guys, I would say that I could hang my hat on and absolutely be certain that the most overused, overdiagnosed terminology when it comes to someone who has pain at the front of the hip, this anterior hip groin pain, is the terminology hip flexor related pain. Tight hip flexors, weak hip flexors, stiff hip flexors. These things are sometimes the most overused terminologies and labels that people put on their hip pain that often can overlook some really vital hip conditions that sometimes can be really life-changing that you can't overlook. Now, there's one thing in particular that we're going to be discussing in this video, that if you are young and active and fit and healthy, really you cannot disregard this potential differential. Because if you take, for example, a young adult population, so let's say 20 to 40, right? Young adult, fit, healthy, active, plays sport, does a lot of exercise, runs, jog, triathlon, football, sport, tennis. These patients in particular are at risk, or I wouldn't say at risk, but also have a common demographic and relationship between sporting capacity, activity levels, and things like labral tears. And in particular, those that have done sport from a younger age, things like FAI syndrome might be prevalent, and also those that have micro instability or hip instability like hip dysplasia, which could also contribute to someone developing a labral tear, may have those close links with those also that put their hip through quite a lot from a sporting and an exercise perspective. So if in that patient group, which will make up such an abundance of a physios and osteopaths and chiropractors caseload, sports therapists caseload, we understand that they are playing sport at a consistent level and presenting to you with pain at the front, you cannot blame that pain on the hip flexor just because anatomically that's where those structures are, because you need to not overlook some of the risks that put them at higher risk for other conditions. And the thing that we're going to be essentially diving into now is a bone stress injury. Now, a bone stress injury is essentially a fancy terminology for saying like a stress fracture or a stress reaction to the bone. Now, consider this, right? So this is our hip joint, right? So we've got femur, femoral neck, and then you've got the joint. So inside the joint, you've got the labrum. And now often for those who have FAI syndrome or hip dysplasia, when they have a labral tear, the structure in there can be the thing that causes the pain anywhere at the front. And often patients say that they've got this C sign of pain at the side of the pelvis, groin, and at the front of the hip. So we have a structure within the joint that could cause pain in the same area as to where the hip flexors are. So on one hand, that can be misinterpreted and blamed incorrectly. But we also have this structure here. Now this femoral neck is let me bring it in a bit. Look, that femoral neck here, that is the prime location to where someone may develop a bone stress injury. Now you're sitting there thinking, right, Mehmet, who on earth would develop a bone stress injury? Now a bone stress injury doesn't just randomly happen. And especially if you're taking out all of the risk factors that can influence bone density, like someone's poor diet, hormonal changes, comorbidities that could influence bone health, let's take those out of the situation and just think, how can a bone in that area get a stress reaction? Because a bone stress injury can cause a bone fracture, or essentially a fractured femoral neck. Now, if you have a femoral neck fracture here, then what could happen is the circulation from here to here is impaired, and you can end up getting something called avascular necrosis. Now, avascular necrosis is not ideal because if you have it and it can't be treated, you end up needing a hip replacement. And we're talking about in a young population. So let's rewind that. So we've got bone stress injury that has a risk factor, and the risk factor there is exercise. And this is when the narrative is so important, because The narrative for someone who has a bone stress injury is not the same story and is not the same narrative, although it could be the same patient group that we started the video off describing. The ones who have hip dysplasia, the ones who have FAI syndrome, and the ones who might be at a higher risk of developing a labral tear. So if you have a patient who fits into that criteria, that comes in and tells you, I've got hip pain for 1, 2, 3 years and it's been slow and progressive, you're not going to start to think bone stress injury. But if you have that same patient coming through your door saying to you, I've started to develop this pain in my hip flexor, I've had it for a couple of weeks, it's particularly worse after I've been running, and then you start diving into their narrative even further, asking them, what's your training profile, what's your history, give me a little bit more context. And then they start telling you like the hallmarks of, I'm training for a marathon, I'm doing a lot of running, I do endurance running, I've upped my mileage, it's worse when I run, it's worse with impact, it settles down with rest. You're starting to see a very different context, a very different scenario, a different narrative. And that's really important to not overlook. You have to remember the fact that patients have all the answers that we need. That patient walking through the door will have all the information that we need. We just need to pull it out of them. But the biggest problem that I see, and unfortunately it is absolutely rife, is that that patient might walk through the door, they're telling you that they've got pain in their hip flexor. They may well have pain with hip flexion. They obviously might also have pain with activity, with loading, with exercise. But with where that structure is on that femoral neck, that's also how that would present. Now, the biggest pitfall that I would see is where the focus is all around trying to treat this weak hip flexor, when fundamentally the problem is the femoral neck that is reacting to the type of sport that that individual is doing, and often that is more endurance type sports. Now throw into the mix the other risk factors. The young, maybe female patient, the one that might even have relative energy deficiency syndrome risk factors, the one that might have hormonal changes that possibly could influence bone health. All of these components potentially would then give you a narrative of someone that sounds very, very different, even though when you're comparing it to the FAI and the hip dysplasia and the labral tears, the demographic is similar and the location of symptom may have a similarity too. But the context, the narrative, the history is not the same. And that is a really important thing to not overlook, because if this gets missed, like I said, that could lead from a stress reaction in the bone to a fracture. And if you have a fracture that is displaced, that isn't picked up, that is misdiagnosed, well, that could cause avascular necrosis, which is what I said before, essentially bone death in the femoral head. And that could be something that really requires a hip replacement. And if you're talking about a 20, 30, 40-year-old patient needing a hip replacement that could have been prevented if it had been identified and picked up and treated properly in the first instance, well, that's something that you've got to consider. If any of this is relevant to you, if this is kind of resonating with an experience that you've had, please comment below. I want to hear from you and let me know your experiences.